Well, let's get into our discussion that we started at 10 o'clock about education. We have via Skype Dr. Faith Khumalo, in charge of care and support in schools from the Department of Basic Education, Shabir Madi, Professor of Vaccinology at the University of Witwatersrand, and we're hoping to be joined as well by Professor Jace Pillay, Chair of Education and Care in Childhood at the University of Johannesburg. And also, before we conclude our discussion, we'll be joined by Colin Cronje, CEO of Brainline, an online school that provides home education, because some parents are considering that, and the department has said it is open to that if parents are really anxious about sending their children back to school. Dr. Khumalo, another point I just wanted to raise, and listening to what Professor Madi had said earlier, and also Professor Mary Metcalf, who's now left our discussion, is that the greatest risk of COVID-19 is posed to adults, teachers and staff, but also children who are now exposed to homes where there might be somebody who's positive with COVID-19. I'm just wondering, from a departmental perspective, are you concerned about the long-term impact on teachers and learners of COVID-19? Because the levels of anxiety are high.
You are very right, Dan. You know, what we have requested should happen is that certainly at the beginning, as we come back to school, the focus has to be about getting used to the new environment and dealing really with some of the psychological and the emotional issues that the adults in the system might have, as well as the children. So I really want to support what Professor Metcalf has said, that generally in education, we haven't paid in the past as much attention as probably we should have around issues of psychosocial support, but that we have placed right at the front following the health and safety precautions, that we need really to start and be kind, be kind to yourself. Understand that your anxiety and your fears are merited because we have never been here before. And so we've strengthened those aspects within education, as well as our links that we have with universities, with independent psychologists and social workers, with the organizations that are well known, such as SADC and many others. And each school would have a level of support around psychosocial support that we are increasing, as well as list of the resources around their area, as well as some of the free 24-hour telephonic counseling services that we have in the country. And we really believe that it is important for us to not come to school and be worrying about the curriculum. Because a lot of the feedback that I've received, I also get a whole lot of emails and WhatsApp messages from the general public. And their concerns are really about those issues. How the learners, the children are feeling anxious, how the levels of depressions are. And we know that as a society in general, we already have prevalent, quite high levels of mental health illness. And so we have to, it's an opportunity now to really prioritize that and make sure that all of us acknowledge and then support one another to really get used to the new norm that we're facing. Okay. Our educators, in terms of their particular health, I think you were asking about the health status of educators. We're fortunate in that we do have some research that we had done in the past to get a sense of the burden of disease, particularly the non-communicable diseases that are associated with severe COVID-19. And so that data is available. We're following the guidance from the Department of Public Service and Administration, as well as the Education Labour Relations Council, in terms of then identifying those educators that would be at high risk, and then begin to able to put in measures for them. If they are able to work from home, that would be the situation, and it would be taken on a case-by-case basis in terms of what we need to do. But we are aware and we are concerned, and we are working with all the teacher unions and, like I said, the ELRC, to really focus also on educator well-being, because they are rightfully also concerned about their own health.
And that's in the long run. Let me bring in Professor Jace Pillay, Chair of Education and Care in Childhood from the University of Johannesburg. Thank you very much, Prof, for joining us at this point of our discussion on education. In your view, I mean, I'm just asking the department if they're concerned, like many people, about the impact, long-term impact of COVID-19 from a mental health perspective and well-being generally of learners and teachers.
Good morning to you and to the viewers. Definitely, I think we need to focus on the mental health. And I think too much of focus has been on the physical health, and we need to give equal importance to the mental health. And undoubtedly, it's definitely going to have a long-term impact. And I think I was very, very pleased to hear that Prof. Metcalf and Dr. Khumalo actually Dr. Faith clearly indicated about the need for psychosocial interventions in the school. And I think it's very important that we begin to start with that as well. And I think the important thing also is preparation in terms of the psychological and social interventions need to start right from the home situation. Even before the children go to school, it's important that the parents start to prepare them. So unfortunately now already we have the grade 12s and the grade 7s are there, and I'm not sure how much of preparation was done. But with the children that are going to go to school in the next phase, I think it's important that parents begin to set some kind of routine. Let the children get up in the same time as they normally should be getting up every morning to go to school, follow the routine of the day as if they're in the classroom, and do the work that is supposed to be doing. In that way, it will actually give them some kind of psychological preparation.
But you know, just to come in, sorry, Prof, just to come in there, I was having a discussion with one of my colleagues who's a parent and has got a child in grade 4. They are just wondering are they doing the right things? Is it just the doing versus the learning? Is the child actually learning at home currently? Because when they go back in the next phases back to school, the challenge on teachers is going to be higher if during this time they actually didn't learn much at home.
I think to answer the question, it all depends on what we do and how we do it. And I think irrespective of whether it's a grade 4 or whatever grade it's going to be, the preparation is important. That's paramount. So whilst we are preparing in terms of the physical aspects with regard to the health issues, I think it's very pertinent that we focus in terms of the mental preparation as well. So there needs to be proper support provided in terms of the psychosocial support that's needed in school. So my argument would be that, yes, they can go to schools, but we've got to ensure that we are doing the right things in terms of the preparation. So the critical thing will be also the kind of mental support that will be provided. I think clearly we're going to see a lot of anxiety, we're going to see a lot of fears, we're going to see a lot of problems that's emerging. So parents and teachers need to be vigilant about this. So they need to know exactly what are the signs and symptoms. So if children are becoming restless, agitated, if they are not even focusing on the studies, lack of concentration, they're having sleeping problems, eating problems, these are signs and symptoms that we need to pick up very early so that we know that we are doing the right thing or not.
Yeah.
So
it's a very difficult one as parents knowing what to do a right thing or not. I'm going to bring in shortly, not just now, the CEO of Brainline from homeschooling. But before we do that, I just want to bring in Professor Shabir Mahdi, the vaccinologist. Just listening to all of this, Prof, I know you not from a psychology perspective, but just from a disease perspective, I mean, people are dealing with the stresses of managing with COVID-19 and they're worrying about sending kids back to school. And you say it's a good thing from a cognitive development for children. And the balancing act, they must be very tough because you have to manage the stresses, the anxieties, while making sure you physically distance, you wash your hands, you carry the mask. The COVID-19 stress is there all the time. And as you said, it's going to be with us for a long time.
Yeah, so I think the critical element here, which is somewhat lacking from our public health response, is adequate knowledge of the virus and the risk that it actually poses to different individuals. And if we can get the knowledge about the virus through to children as well as to teachers as well as to the communities, we would be much better off in terms of reducing the stress that exists around the concerns over COVID-19. So COVID-19 is a serious problem, but at the same time, it really selects out a specific group of the population that are at highest risk of developing severe disease and dying. For the best part, the majority of people, close on to 95% of people and 99.9% of children that are infected with this virus will be completely asymptomatic. They're not going to know that they were sick from the virus, that they were infected, or they'll have a very mild illness. Now, the situation isn't assisted when the type of response that we got to COVID-19, in fact, is completely unscientific and actually lends itself to more fears. As an example, what was sort of flighted on Al Jazeera last night or night before last was some of the children that were returning to schools in South Africa, they were being sprayed with some chemical all over their body as they were entering into the school. Now, firstly, decontamination tunnels, as well as that sort of spraying of individuals as they're entering into a school premise, is completely unwarranted. There's no benefit from it. In fact, it can be harmful to the child to be sprayed with those chemicals. Now, those sort of things that happens actually heightens the level of fear about this virus without actually having much benefit. So we need to become much more calculated in terms of how we go about projecting what the virus is all about. So I was glad to hear that when children returned to school, the first day of the schooling, the focus was meant to be about the virus and about COVID-19. What needs to happen is that children, as we get them into the schools, they need to become vectors of knowledge about this virus. So they can go out back to their households to actually explain to the parents in terms of what this virus is all about. Unfortunately, like I said, we haven't paid enough attention, and I agree. This goes beyond a medical issue. We don't just need medics and epidemiologists to deal with this issue. We need behavioral scientists, we need anthropologists, we need psychologists to come on board in terms of getting the messaging through as to what the virus is all about, as well as what interventions people need to adopt and why it's important for people to adopt those sort of interventions.
Make very valid points. Thank you very much for your time, Professor Madi. We'll be continuing our discussion shortly, and we'll shift our focus a little bit now as we end this hour's discussion on education to homeschooling.